Such is politics. Anywho, to the feature story that I had told you about. So tonight, we turn our attention to an urgent crisis on the country's doorstep. TB, or tuberculosis, is now tightening its grip, just as critical funding to fight it is fading. Now, this is a story of a 6-year-old boy fighting multi-drug-resistant tuberculosis, a disease now outpacing the medicines meant to save him. But his struggle is not just medical, as international funding dries up and donor priorities shift. Kenya's hard-won gains against TB are slipping away, leaving TB patients like him at the edge of a system stretched to breaking point. Co-produced with Different Terror Media, this story follows Jaden's fight with the disease, examines just how deep the funding gaps run, and what it means for the fight to save lives from a disease that still kills thousands every year. Our special report, Gasping for Breath, starts right now.
When a child coughs in silence, who hears? When funding runs dry, a collective gasp echoes in the void. The cost of this silence is counted in the lives of those too small to speak for themselves, too young to fight for the breath they so desperately need. From above, Kibera unfolds like a handmade tapestry, threads frayed, colors worn, yet bound with the strength of countless lives woven tight. Every winding path is a river of stories. Some ripple with joy, others carry the weight of resilience. Along its current, a 6-year-old boy's story drifts gently, marked not just by struggle, but by strength. His childhood has been seized by a ruthless intruder, multi-drug resistant tuberculosis, a disease that defies two of the most trusted medicines in a doctor's hand. The illness clung to him like a shadow, stealing play from his afternoons and laughter from his breath.
Ilikuwa sasa graduation ya brother yake. So time tulikuwa tunaenda graduation, nikaona hayuko sawa, hayuko normal. Tumemzoea anacheza, anafanya nini, akisikia kitu mnaenda mahali, yeye ndo mtu wa kwanza kutoka. Nikaona hapana, hii si normal. Tukimpeleka hosi hapa tu hizi za clinics za hapa za kawaida chemistry, anapewa dawa kukohoa, so changes hakuna. So ndo asubuhi nikamka naye nikampeleka Coptic. Juu alikuwa worse kabisa. Mwili yake iko joto, analia tu. Ndo tukampeleka Coptic. Akalazwa. Kulazwa, daktari akakuja kwa kumpima. Akasema hii signs ni za TB sasa.
Tuberculosis in children is a master of disguise. It wears the mask of common childhood fevers and coughs. Unlike adults, children rarely cough up the sputum needed for a diagnosis, and their bodies carry too few bacteria for standard tests to find. As a result, thousands slip through unseen, undiagnosed, untreated, invisible. In Kenya, nearly half of all the pediatric TB cases go uncounted, and the youngest, children under 5, bear the greatest risk of dying. The World Health Organization now offers a new map for doctors. Algorithms designed to catch more children with TB and begin treatment sooner. Like a guided flow of decision, each symptom, cough, fever, night sweat, weight loss, adds weight to a score. When the threshold is crossed, the path is clear. Treatment should not wait.
I know one of my clinicians here is trying to look for a biomarker in the sputum of the children. And of course that sputum has been efforts to get it, interventions to get sputum have been put in place, because children also to cough out the sputum is not easy. So an invasive way has been used to get either gastric lavage or you give a nebulizer and see whether they can it made them cough more to get the sputum. So there are efforts, but we are also emphasizing the skill, the clinical skill.
Immaculate's son was soon after his diagnosis put on TB treatment, but the disease had already tightened its grip.
Niko na kitu inafura kidogo kidogo tu na asikii uchungu, ako tu sawa anacheza. Ndo nimeona imefura kabisa. So ndo nikaenda tena na ecoptic. Ndo daktari wa peds, nikatuma kwa daktari wa peds surgeon. Akaniambia, mama Jaden, enda kwanza ufanywe ultrasound ndo tujue ni nini shida. So nikaenda ultrasound ya kwanza, wakamuexamine, jela ioneshe vizuri. Ndo so siku hiyo tema aliniambia nirudi, akapima tena wakamfanyia hiyo ultrasound. Ndo akaona hii kitu ni kubwa sana, imekuwa wasiko deep. Ndo hiyo Friday tarehe 4 asubuhi ndo tukaenda kwa theater sasa. Ndo akatolewa, ndo tukapimwa kila kitu, ndo tukaambiwa ni DRTB. Unaona shangaa mtoto kama huyu DRTB anatoa wapi na ni mdogo. Ndo daktari wa TB akakuja kaniambia hata mtoto wa 2 years anaweza patwa nayo ama hata 1 year.
So began another daily marathon of pills and prayers.
Vile dawa zililetwa, first time niliambiwa na daktari, dawa ni mingi na ziko na nguvu. So hii dawa mtampea na maji. The best way ni strong tea, niko na nguvu. Na mtoto akipewa inakaa tasteless kwa mdomo wake. So inafaa kitu tamu, either juice ama strong tea, at least ikuwe na sukari. So hii tumbler moja unaweka dawa 7. Alafu kuna hii nyingine ni nusu half. Unampea asubuhi na jioni. So kwa hii nusu unatoa 2.8. Unakuja kuweka kwa hii tumbler yenye ziko 7. Dawa zenye umeweka ndani 7, alafu na shake pamoja ndio unampea. Na hii dawa ukishampea unaacha like 10 minutes apumzike kwanza. Ndio mpeleke shule, alafu anamwekea chai ya maziwa kwa chupa. Ndio ende nayo shule sasa akunywe. Jua maziwa haifai umpe nao na maziwa. Atatapika yote na dawa haiwezi function. Dawa tunampea 8 asubuhi na 8 jioni. Na 7:55 tunaanza kuzimix. By 8 exactly tuko tushampea. Every 8. Usikose, usifanye nini juu the moment unakosa kumpea hiyo by 8 dawa itafanya.
In recent years, the battle against childhood TB has found new victories. For instance, short, gentler treatment that no longer steal a year from a child's life. The bitter taste of treatment has also softened into child-friendly medicines. And community health workers thread through the narrow lanes, bringing knowledge and care to families like Immaculate's, who once faced the disease alone.
Hawa clients wanaonekana na daktari mara moja kwa wiki, so na make sure on Wednesday wamekuja kwa clinic kuonekana na daktari. Na the last Wednesday of the month kuna ile kikundi yao Kenyatta Hospital ya MDT ya kudiscuss kujua client anaendeleaje kwa matibabu, kama kuna vipimo alikuwa ameambiwa the previous month apime, kama zikoje, anaendelea vizuri. Hiyo pia na wa accompany to Kenyatta Hospital kwa hiyo MDT. Mimi kama CHP nimedeal na cases mingi sana za TB kwa kijiji. Na most of the cases nimedeal nazo sijaipoteza mgonjwa out of TB. Mimi hufuatilia mgonjwa kwa karibu sana. So mimi kama CHP na mimi bado ni mama, niko na watoto wachanga. Niliona tukimkataa ataonekana na nini, cause among the health workers saizi kwa community, kwa facilities unapata hawataki kuassociate na mtu mwenye ako na DRTB.
But these gains rest on loose soil, hard won yet easily undone.
2 things have happened this year. One is now that withdrawal of the US funds to support TB interventions. And number 2, a few months later, Global Fund also gave a directive that we reduce our investments to TB or reduce our expenditure on TB by 15%. That is the monies that they had given us. Now, these 2 directives have come when we are quite advanced in the process of our national budgeting process. That means we had already we had planned, like we have the US funds to take us through the year. And even for Global Fund, we budgeted and planned, not knowing that we were going to have to reduce by 15%. That means there are interventions that have been planned but have no funds to implement them.
Much of the fight against drug-resistant TB in communities still leans on donor grants. And while HIV and malaria draw more of the nation's health budget, TB often waits at the back of the line. When the funding fades, so too does the lifeline for families, the listening ear, the tracing of hidden contacts, all the quiet essential work that holds patients through the hardest part of the journey. Over the past 2 decades, Kenya has slowly pushed back the shadow of TB. Since 2000, new infections have fallen nearly by half, and deaths have plummeted by more than 60%. At KEMRI, the search for a TB vaccine carries the weight of hope. In Nairobi and Siaya, more than 1,500 infants are part of a major trial for a new vaccine. Another trial is testing protection for adolescents and adults. Alongside the world, KEMRI is part of a study that could bring the world's first new TB vaccine in over 100 years.
Some of us have latent infection, meaning that you have the bacteria within you, but you have no symptoms because you have no, it's just within you, and because of your immunity, you carry it, but you don't have the disease. Right now, the product we are investigating is called M72. If we give them this product, will they progress into getting the disease? And we are applying this to adolescents and adults. In the community, 25% of us, it's estimated, have latent TB. The rest of us may not have it. So what about those who do not have it? If we give you this product, will you progress into disease? We also want to make sure that we include the vulnerable groups in this investigation. And we also have a cohort of people who are well controlled. They are HIV positive, very stable, on ART, well controlled. Whether if we gave them this vaccine, would it prevent them from getting TB?
But the fight is still starved of resources. Since 2022, KEMRI's research funding has been cut by half. In 2023, out of the 7.2 billion shillings needed to keep the country's TB response alive, only 2.7 billion came through, leaving a deep 60% gap where care should have been. The Global Fund, USAID, the Clinton Health Access Initiative carry the weight, while the government share remains modest. The National TB Strategic Plan is a blueprint drawn in bold strokes, but the gap between vision and resources yawns wide. In 2024, the country needed 17.6 billion shillings to fuel its fight. In 2025, the gap widens, 21.4 billion required, but just 3 billion projected.
The health of a citizen should be the responsibility of the government. Partners and donors should only be complementing what the government has already done. But our situation has been completely opposite, where we are relying over 90% on donors and only investing about 10%. Now, reversing that equation will take a lot of time and will take a lot of shifting our mindset as a government. We need to see the government increasing the investments to health generally from the national government. And number two, we need to see counties also prioritizing health. We have been engaging several counties, and we've been engaging the members of the county assembly because they play a very big role in making a decision on how the funds from the counties are allocated. And so we are hoping in the next financial year, we shall see those two things, an increase from the government and an increase from the counties.
The plan is a call for creativity to tap into new wells of support beyond the health sector.
I will take an example of the Ministry of Education. About 13% of the TB burden in Kenya is among children below 15 years. children below 15 years are more likely to be in learning institutions, in schools. TB is also more prevalent in young people between 24 and 35 years. A majority of those are likely to be in the universities or in tertiary colleges. Therefore, we cannot expect the Ministry of Health to be able to address that burden that is not within their catchment area, so to speak. So what is the responsibility of the Ministry of Education? They can take a role, for example, ensure periodic screening in schools, ensure creating awareness. Every sector can take up a role. And once they take up a responsibility, then they take off the burden even of the funding from the Ministry of Health. So we have to spread the burden across other sectors.
It's a fragile balance. Every outreach visit, every breath reclaimed depends on funding that could vanish with the next financial wind. So resources for TB must be ring-fenced, protected from shifting priorities. For Immaculate, the struggle is not written in charts or budgets, but in the shallow breaths of her 6-year-old son, through the nights of fevers and days that felt endless. And yet, she holds on to hope that no mother should have to watch her child fight a battle this heavy.
Mwenye hata alitupea nguvu ni wa 2 years, alikuwa mtoto. Yeye sasa yeye alijulikana through kufanya operation kwa kifua heart. Ndo akaambiwa kwa heart yake ilikuwa na TB. Sasa alianza kuanameza dawa for 2 years. So kitu nilinipea courage, niliona vile mamake anampea dawa. Hata nimeona vile Jaden anaendelea, ako sawa, ako strong. Kucheza anacheza kama kawaida. Si hapo vile mara kwanza vile alikuwa weak. Hata weight inaongezeka. Mimi wish yangu ajue anasemanga akitaka kuwa mkubwa, anataka kuwa pilot. Sasa healthcare yake naiweka vizuri ili isikuje kumdestroy vile alikuwa mara ya kwanza.
Our children's future shouldn't depend on luck or handouts. We should protect them with real, lasting support. Because this fight isn't about numbers on a page. It's about their breath, their laughter, and a future no one can take away.